The first signs of death, and the important ones, are the cessation of the functions of the circulatory, respiratory, and nervous systems. Changes begin to appear in the face and condition of the deceased, with the relaxation of the sphincters being a significant one. The examination of these signs is insufficient for the diagnosis of the 5 most common causes of sudden death are as follows. AR acute myocardial infarction, heart attack, intracranial emergencies, such as non-traumatic brain hemorrhages and vascular blockages, pulmonary embolism, blockage of the pulmonary artery, aortic dissection or aneurysm. What are the causes of sudden death during sleep? Sleep apnea, which can lead to metabolic and vascular diseases such as diabetes, hypertension, and obesity, is among the causes of sudden death during sleep. Patients describe apneas that occur during sleep as waking up. How does someone nearing death behave? The hands, arms, feet, and legs of an individual approaching death begin to cool. Skin color changes, turning black, darkening, or becoming gray or pale. The pulse becomes irregular, rapid, and weak. Blood pressure drops and peripheral circulation deteriorate. Sudden death accounts for 12% of all deaths. Half of deaths from heart diseases occur as sudden death. Sudden cardiac death causes more deaths than those caused by common cancers, making it a more significant health issue than cancer. 80% of sudden deaths develop as a result of coronary artery disease. In 20% of patients, the first sign of narrowing or blockage in the arteries supplying the heart is sudden death. Although sudden cardiac death is more common in older adults, it can occur at any age, even in children. Regular heart checkups are the first step in preventing heart diseases from developing and progressing, as well as preventing sudden death. In many countries, sudden cardiac death is the most common cause of death among young people, aged 20 to 30, even more frequent than deaths from traffic accidents. Certain hereditary diseases can result in sudden death. Therefore, those who have lost close relatives to unexpected sudden death should be evaluated in this regard. Mobile emergency medical units can resuscitate some individuals who experience sudden death. Implantable defibrillators, AIC or AICD, can prevent sudden death by correcting the fatal arrhythmia in patients at high risk of sudden death. Sudden cardiac death is not fate, it is preventable. While the majority of sudden deaths occur due to narrowing and blockages in the coronary arteries, heart muscle diseases, cardiomyopathies, electrical disturbances of the heart, conduction disorders, aneurysms and ruptures, and some valve diseases can also cause sudden death. What is sudden death and can it be prevented? Although it can have different definitions, sudden death is generally defined as when a person without any apparent acute health problems suddenly becomes unwell and dies within an hour. Although sudden death has various causes, it is most often related to the heart. The most common cause of sudden death is sudden arrhythmias. Ventricular tachycardia and ventricular fibrillation are the most frequent arrhythmias leading to sudden death. Heart-related causes are mostly sudden rhythm disturbances that develop on the basis of coronary artery disease. Contrary to popular belief, heart attacks are not the most common cause of sudden death. Although sudden death is frequently seen during heart attacks, the majority of sudden deaths develop on the basis of underlying chronic coronary artery disease. Non-cardiac causes include stroke, major arterial diseases, aneurysm rupture, and pulmonary embolism. Sudden death can occur in individuals with previously known and diagnosed diseases, but unfortunately, it can also occur in individuals with no known illnesses. In fact, in some people, sudden death may be the first and unfortunate sign of coronary artery disease. Therefore, take care of your heart health, get checked, know your heart risks, and seek help to reduce those risks. What are the diseases and conditions that carry a high risk of sudden death? Coronary artery disease. Sudden death can occur at any stage of coronary disease. However, the risk of sudden death is higher in patients who have had a heart attack, have impaired heart function, and those with advanced heart failure. Heart attack. The risk of sudden death is high in the first hours of a heart attack. Sudden deaths due to arrhythmias, ventricular fibrillation, frequently occur within the short period between the onset of heart attack symptoms and reaching the hospital doctor.